Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing cosmetic or aesthetic plastic surgery in the Scottsdale-Paradise Valley area since 1992, and all I perform is cosmetic or aesthetic plastic surgery. I have a lot of patients now coming in and asking, what is a GenXLift? I've had a lot I feel lucky, a lot of publicity for this now, and this is a very exciting thing in my practice. It's a proprietary procedure that I developed over the last couple of years in response to a need that I see. You know, I've been doing facelifts for about 23 years now, and there's a population of patients that are afraid of a traditional facelift. So a GenXLift addresses those patients. Basically, a GenXLift is for patients that are somewhere between 33 and 53, and those happen to be the GenX-ers. That's the Gen X generation. A GenXLift addresses all the aspects of facial aging in a patient prior to the age of the baby boomers. And there are generally three things that happen with facial aging. There's skin aging that you see pigmentation changes from sun damage. You also see loss of elasticity and collagen production. You secondly see fat descent and fat loss in the face. It doesn't matter if you're even in your 30s and you're at a nice weight. Normal aging, you see loss of facial fat, and that gets rid of, or that causes loss of that voluptuous looks that you had when you were younger. So fat transfer is a very important part of my facial rejuvenation. And lastly, there's aging of the neck and the cheek region. When people start to see some laxity of the neck and loss of the jawline, along with descent of the facial fat and cheek fat with jowl formation, those people tend to be good candidates for the last phase of a GenXLift. So let me describe what the GenX phases are. The earlier phase would address a younger patient, and the GenXLift in that patient would involve some laser therapy. I like to do what we call a 4-day laser peel. That involves a micro laser peel along with profractional laser, which causes collagen production. So it eases up the pigmentation changes and causes tightening of the skin and increased collagen production. So in a younger patient that has very early signs of aging in the Gen X generation, that would be the first phase of a GenXLift. As people get a little older, they start to see loss of definition of their jawline. So it would be the 4-day laser peel along with fat transfer, along with something that would go ahead and treat that loss of jawline and neck definition. That could be some liposuction, it could be Ulthera, or it could be thermi radiofrequency treatment. All of these things can be done in the office under local anesthesia. Lastly, in patients that have more advanced aging, but maybe not ready for a full facelift, and now why would they not be ready for a full facelift? They may not be psychologically ready for it. I think there are a lot of patients that feel that they're too young for that sort of thing. They can't fathom having a traditional or a full facelift, or even the word facelift, in their late 40s, early 50s. So those patients are great candidates for a GenXLift. I think there are those patients that feel as though they can't tolerate the recovery for a traditional facelift. Again, those patients are great patients for a GenXLift. And lastly, if people want to avoid going to the operating room and more prefer to have something done under local anesthesia in the office, they're great candidates for a GenXLift. So the last phase of the GenXLift, once again, is done under oral sedation and local anesthesia in the office. That involves a short scar facelift with elevation of the deep tissues of the face. It's called a smastectomy, along with fat transfer and laser therapy, which includes micro laser peel and profractional treatment. Those patients have a little bit more advanced signs of aging, but still are great candidates for the GenXLift. So the best way to figure out if you're a candidate for the GenXLift is to come in for a consultation, bring in some pictures of what you used to look like when you were younger, and point out with a mirror exactly what's bothering you. And I think that we can come up with a structured plan that meets your expectations or exceeds them in a fashion that doesn't break the bank and makes you feel secure with where you're going in terms of facial aging, and kind of puts that spring back in your step. So the best way to do it is come in for a consultation. Thank you.